A physical therapist is examining a patient for possible lower extremity weakness. Passive range of motion is within normal limits. The patient is seated. When the patient tries to dorsiflex and invert the right foot, the patient is unable to move it through the full range of motion and is unable to take any resistance applied by the therapist. During the subsequent gait examination, the therapist should expect the patient to display which of the following gait patterns. Option A, normal gait with no deviations. Option B, increased right hip flexion during the mid-swing phase. Option C, throwing the trunk backward on the right side shortly after heel strike, initial contact. Option D, laterally bending toward the right side during mid-stance. And the answer is Option B, increased right hip flexion during the mid-swing phase. Explanation for this question is, the anterior tibialis showed poor, 2/5 grade strength during the examination. Because this muscle is active during swing phase of gait and shortly after initial contact, one would expect to see gait deviations showing up at those times. Specifically, the anterior tibialis maintains dorsiflexion of the foot during swing phase and controls plantar flexion after initial contact.